CEO Eurordis, Plant Diseases Europe, Yann. He is with us remotely.
Yann, how are you?
Thank you. I am very well. Thank you very much, Anna, for your invitation this morning.
Oh, thank you so much, and the floor is yours.
Thank you. I'd like first to express the warmest wishes for the 40th anniversary of the Hellenic Cystic Fibrosis Association and to congratulate you and all the Hellenic Cystic Fibrosis Association and its volunteers in the last decades for the great work that you've been doing. You managed to do successful advocacy to change what it means to live with cystic fibrosis in Greece, to improve the quality of life of the persons living with cystic fibrosis and their families, and to improve access to diagnostic, to treatment, to care, to lung transplants. It's also important that Rare Disease Greece, which now exists in Greece, gathers together all the rare disease patient groups existing in Greece. So it's very important that the Hellenic Cystic Fibrosis Association, as you are, is a member of Rare Disease Greece and take an active part in order to develop a national strategy and to be part of the European and global processes on rare diseases. This will improve the situation of persons living with cystic fibrosis in Greece, because then you're not alone, but you can count on each other and represent a critical mass in Greece and a political voice. I'd like to share with you a few reflections, but before, I'd like to start by saying that I'm the Chief Executive Officer and founder of Eurordis, Rare Disease Europe. And in fact, I am one of yours because I'm a father of a young adult affected by cystic fibrosis. I have 3 daughters, and the oldest one, Colleen, has cystic fibrosis. She's now 33 years. She had a double lung transplant 5 years ago, and she's currently waiting for a kidney transplant. One of the family members will give her a kidney. And she has also diabetes and many other comorbidities, as I am sure many of you have. And exactly like in the video that we just heard, you could not see it. If you was coming in the room where you are, you will see just a young, beautiful woman who is a lawyer working in international affairs. And she's a hard worker. She works 4 days a week, but she works hard. And she has a good social life. And she's able to say that she's happy in spite of all the huge care that she has to take every day, every week, every month, like all of you. For that reason, I have been also, like some of you, have been a volunteer in the French Cystic Fibrosis Association, Vaincre la mucoviscidose, and I was the vice president for research for almost a decade. Before, with my wife, we decided to have a 3rd child, and part of the negotiation was to stop to be a volunteer in an association in addition to work in another association. But today, I still continue once in a while to help this French association. Recently, we had a seminar on the long-term strategy to assess the impact of the new treatment and what it means in terms of new challenges to identify where the focus of the attention of the association should be, and also how to prepare for bigger changes, as maybe there will be less volunteers, less attention for cystic fibrosis. I'd like to mention here one thing that I can see at the European level, and that's important for you, is that there is a lot of discussion at the European level about what is called the unmet medical needs, to prioritize the development of medicines, to prioritize research, to prioritize allocation of money for the diseases where there is not yet treatments. And I am sure that for you, as for me, I will consider cystic fibrosis as one of these areas of unmet medical needs, because even though there is important treatments that now have been approved in the last years, we see that we are far from having a satisfactory solution, let's say, for all patients. There is the patients who don't have mutations for which there is treatment, But even when you're taking the tree therapy currently, you can still continue to develop difficulties. You can go at the hospital. You can be stopped from going to work. So we're far from having solved everything, and we still don't have a cure. But however, that's for us. That's how we see it as clinicians, as parents, as patients ourselves. But whole society around us, including scientific, including policymakers, they think the problem is solved for cystic fibrosis and that we need to move to the next disease. So we need to be very careful and to advocate very strongly to express what are the current realities of living with cystic fibrosis, even with the treatments, and what are the solutions, the pathways needed for the next years, so that there is unmet health and social needs, which are recognized. With that, I'd like to highlight that cystic fibrosis is one of the diseases at the European and even global level, but particularly at the European level, where there has been huge gains. I don't know exactly, but more or less when you look at the observatory, we can consider that we have gained 6 months of life every year in the last 30 years. That's huge. It's huge. And the perspective for the child we were born 30 years ago, 20 years ago, and the perspective of being born today with cystic fibrosis are obviously very different. And this was thanks first and foremost to the organization of healthcare, the multidisciplinary consultation, the specialization of cystic fibrosis clinics, the networking of doctors between themselves at the national level and now at the European level, the sharing of good practices in diagnostic and care. So bringing the knowledge together and applying the existing knowledge, but also generating new knowledge on how to care for persons living with cystic fibrosis or children living with cystic fibrosis. And there is a model here which can apply for other rare diseases. And it is first this improvement on the diagnostic and the newborn screening, on the care, the management, the day-to-day management, and the strategies of autonomy of patients, therapeutic education, physical therapy at home, IV cure of antibiotics at home, which have been able to gain these 6 months of life expectancy until there is now the transformative treatments, which hopefully are helping us to gain much more, maybe 9 months, 10 months, 12 months per year, until maybe we will live a normal life expectancy with the disease or with a cure. Now, to conclude, I would like to highlight how your action for cystic fibrosis in Greece is linked to action at the European level in cystic fibrosis, but also what you do in Greece with the other rare diseases is linked to a bigger movement and policy at the European level on rare diseases. You are connected to the CF Europe, Cystic Fibrosis Europe, which is your European federation. And once in a while, I also do some volunteer work for them to help them to create, for instance, a community advisory board on cystic fibrosis to engage with the different companies for the development of their treatments, but also to create the roundtable of companies in order to attract funding to the Cystic Fibrosis Europe and be able to develop more activities. And there is huge challenges, obviously, on access to care, simply not the diagnostic, the newborn screening and the care in Europe at large. There is still huge inequalities, obviously, across EU, but also even more so across Europe at large. And that's an area to focus on. But it's important to continue to influence from that platform at European level the future development of medicines, but also the organization of healthcare. As the number of lung transplants, for instance, will decrease for cystic fibrosis, we need to ask ourselves how we should be organized at the European level. And can we still maintain lung transplant units for cystic fibrosis in every country in Europe? Or should we organize ourselves in a more rational way so that there is some teams which are doing regular procedures and can deliver a quality transplant where you go. So we'll have many challenges of this sort. We certainly also have challenges ahead when new therapies, maybe gene therapy, maybe CRISPR, whatever the strategy that will work. But when there will be the curative treatment coming in, it will be an even more difficult debate to have access to it in Greece, like in the other countries. We will have to justify what is the gain for the healthcare system financially to pay for that higher cost treatment compared to the existing cost of treatment today, compared to the absence of school or absence from work, or the absence of the parents from work, and etc. And you have the European Reference Network for the lung rare diseases, of which cystic fibrosis is part, and that's a wonderful asset. We will have soon also the clinical research networks for rare diseases, and there will be one, obviously, around the lung, and that's important to follow. And all of them, all these networks are sharing progressively the same standard, the full interoperability of data. We're still far from that, because the problem is to collect the right data. And that's another area where an association like yours is important, to make sure that your clinicians in the hospital have the right resources to be supported, to collect the data and enter the data in the registries in order to be able to share. We can have the best standard of the world, the best interoperability. If we don't collect quality data at the clinic where the doctors and the patients are, we are not transforming the care. And last but not least, is just to say that now we are entering a new phase of policy development for rare diseases. You may know that in 2019, a text was adopted by the United Nations General Assembly for universal health coverage, which is a beautiful objective. It's an utopia somehow, but it's important. All the member states in the world have engaged in saying, we will provide universal health coverage to certain population. And together, all the patient groups, we succeeded to obtain that rare diseases are part of that universal health coverage, which means that any person with a rare disease in the world is supposed, probably long term, but to have the right services and the right financial coverage for their needs. But that has started in many countries, obviously in Europe since a long time, in many countries around the world also, and in an increasing number. And I can tell you, I can see progress every month in that direction, which is very encouraging. And that commitment of the United Nations was done again with all member states this year in September in a second political declaration on universal health coverage. We have also gained in 2021 a United Nations resolution to recognize the challenges of the 300 million persons living with a rare disease and their families. And this is a more detailed document about the needs and about the type of actions that member states should engage and that the different agencies of the UN system will engage. And we are now already en route in working on a WHO, World Health Organization resolution on rare diseases, which we hope to be adopted in 2025, and 2 years later to adopt a global action plan on rare diseases, looking toward 2040. So, and that here there will be objective goals. And I insist on that because I think that for Greece, that's important. We're trying to obtain goals at the global level, global goals in a European action plan for rare diseases, which we hope after the European Parliament election and the new Commission, it will be adopted. There will be a European action plan for rare disease in Europe and a new generation of national plan and strategies in every country. I know you recently adopted a strategy in Greece because I was part of some of your conferences and listening to the colleagues working on that. And that's great, that's fantastic. But your next generation of plan needs to have goals and goals aligned with these European and global goals. And that's great because it helps to federate our actions. It helps to have much more efficiency to improve the survival, the quality of life of living with a rare disease, the inclusion of society, the potential to live or full potential and to live with independent autonomy. Thank you very much. I wish you a great conference. I saw your program. I was particularly pleased by the fact that you're also looking at what's happening in the United States and you're covering the different challenges of the moment across. And I really praise your efforts. And although I cannot follow, obviously, presentations in Greek, my spirit will be with you during all that day. And I wish you a very fruitful conference. Thank you.
Dear Yann, I would like to personally thank you. First of all, thank you for your warm wishes about our anniversary of the association. Thank you for sharing your story with CF as a member of our CF family. And first of all, thank you for your contributions. All these years, you are the founder of Eurordis. You have done an excellent job. And I feel very lucky to be a new member of the board of Eurordis, of this great team. Thank you, Yann, for everything. Thank you very much.
Thank you, Anna. We're happy to have you. Thank you again for the invitation today. Thank you.
Ο κύριος Yann Lecam, πολύ σημαντικό που...
Mr. Yann Lecam, it's very important that he participated today. I wish we could have him physically here.